to the Veterinary Financial Podcast, where we discuss financial freedom and professional success. I'm Meredith Jones, a veterinarian and financial planner for vets.
And I'm David Azis. I'm also a financial planner for vets. So today, we want to talk about comp, how vets are paid, and just kind of riff a little bit on it. Because what I found is if you just take a moment to reflect on how veterinarians are paid, it's kind of weird and sometimes very unnecessarily complicated and convoluted. Mm-hmm. And so there's a bunch of different ways that veterinarians get paid. We're going to be focusing on the most predominant ways that most veterinarians are paid, which Meredith will define in a second. We'll just discuss not just how vets are paid, but how vets might think incorrectly about how they're paid and some of the problems that come with different predominant pay structures in vet med. And so this is really just a conversation about how weird comp can be for veterinarians, and hopefully some people can take away some things from this conversation of, oh, I didn't think about it that way, and if I do, maybe I'll make more money, or just some tips, tricks, and things to think about that might help you maximize however you get paid, ways to just make more money. Because I don't think this is a topic that's probably talked about enough, is just how weird some of these scenarios can be. So with that, Meredith, define some of the ways that vets get paid and what we're going to be dissecting.
Comp is complicated, and so there are three ways, and I'm going to focus on veterinary associates and how they get paid, because of course if you're a relief vet, then it's probably like an hourly or a shift pay, but let's focus on the more complicated structures, which often apply to associates, right? So salary only is the simplest one. Salary only, you just, if you make $140,000 a year, you make $140,000 a year plus your benefits, of course, which we've talked about on this podcast before. Benefits are hugely important. Go back and watch a previous episode where we focus on benefits, because we've done a lot of that in the past. Salary is the simplest one. Next is a base salary, or some people call it a guaranteed salary, plus production pay. So when we're talking about that, we're saying, okay, let's say in the same case, you make 140 as your base. So you're going to make 140,000 that year. And then they say, okay, well, if your production, so if the money that you produce for the practice, the money paid to the practice from clients is above a certain threshold, then you get production pay on top of that. That's actually the most common way that veterinary associates get paid. And there are studies showing that's the most common way. Another term that comes up a lot is ProSal. A lot of people, when they think of that salary plus production, like what I just explained, a lot of people call that ProSal. Now, technically, that is not ProSal. That's not like a pure ProSal. So Mark Opperman, who was a veterinary management consultant, wrote a book and everything on the art of veterinary practice management. He is the one who actually coined the term ProSal. It was a little bit different from what most vets actually get paid. And so that requires annual reconciliation. So instead of like a monthly or quarterly reconciliation, like most vets who are on production, it was annual. He said you've got to get paid 24 paychecks a year versus a lot of vets are getting paid, every other week. So that ends up being 26 paychecks a year. So ProSal, from a technical perspective, is actually a little bit different. Most vets are being paid salary plus production. David, with that being the most common, what's an example of how salary plus production is supposed to work?
So just to use some really easy numbers, here's how salary plus production is supposed to work. Or like Mara said, a lot of people, practices too, will call it ProSal, even an offer letter, but it's really just salary plus production. And so the way it's supposed to work in most cases is, let's say, for example, you are being paid a 20% production. You might see a range, it's very common that it's somewhere between 20 and 25% that we find are the average percents being paid out for the production. And it can get more complicated too, because maybe on prescriptions, meds, all that kind of stuff, those might be paid out at 10 to 12%. It just depends. But for this example, Let's pretend your production percent is 20% on everything. And let's say that you brought in, associated with your name, $1 million in revenue for the year for the practice. Okay, well then if that's how much you brought in and you got a 20% production, that math would say 200 grand. 20% times $1 million is 200 grand. If your base salary is 150,000, well then that means you should have made 50 grand in production that year. And sometimes they'll pay it out monthly on a monthly basis. So they'll recalculate your production every month. Sometimes it's quarterly. I've seen that too. Rare to see it annually, like you only get one production check, but it can happen. That's how it works. Whatever that math is above and beyond your base, that should be your production. So you make $1 million times 20% is 200K. If your base is 150, that's 50 grand in production. Should be simple, right? But not really. There's a lot of complexity that goes into calculating a vet's correct pay when that's the formula. Because let's think about this. Or I'll give you a life example from my own life, actually. When I used to work full-time as a mortgage loan officer, and this is how the majority of mortgage loan officers are paid, is they're paid off commission. Maybe if you do between 5 and 10 loans in a month, especially in this market, that's considered really good. What would happen, very common, not against any employer, it's just math times all the employees you have, there's a lot of room for error. And so let's say you had 5 loans to compute commission on, and every loan would be different because every loan size is different. It was not uncommon for someone's commission to be calculated incorrectly. Every single month when you get paid, you would do your own math to make sure that the employer didn't make a mistake. And I don't think they were trying to make mistakes. It's just sometimes you get overpaid too. Rarely. Usually it would be underpaid somehow. But that's for a different discussion. But either way, math errors happen. And this is on a sample size of like 5 to 10 transactions, heck, 3 to 10 transactions per month, that there would be errors in what you were paid. And you'd have to go figure it out yourself. Take a vet now who might see 10, 20, 25, 30 clients in a day. Let's say it's 20 clients in a day, times all the different things that they did for those different clients and those different animals. One client, it's not just that client had a bigger loan size versus this one had a smaller loan size. It's you could have a completely different, scenario for one pet versus the other. And you could be prescribing 5 different things. You could be doing a surgery. There's so many different combinations and permutations for each individual client that you see. So that times 20 different clients times, let's say 4 days a week on average, times the entire month, you literally have associated with your name like hundreds, sometimes over 1,000 individual line items of charges that they're supposed to calculate correctly a split off of to go into your production pay. And like I said earlier, it's not usually 20 to 25% on everything. It's that on different things that you do, and then you have maybe a different percent that gets applied towards different types of meds. So that makes it even more complicated. So you have different ratios applied to thousands of transactions, maybe 10,000 plus transactions throughout the year. If it was not uncommon to make tracking errors on 5 transactions that I did in a month, oh my gosh, there's so much room for error when we're talking a vet's pay, when it's thousands and thousands of individual transactions. How do you solve for that? Because it wouldn't be unreasonable for the employer to make mistakes, even if they're trying their hardest. But then what's the vet supposed to do? Spend 100 hours a month trying to track that? It's a lot of work. You don't have enough time in your day for a vet to be a vet and to also track this correctly. So most vets just don't. They just get their production summary and they go with it because it would be an insane amount of work to double check it. It wouldn't be worth your time. I don't know if I have a solution to this. I'm just pointing out that the vast majority of the way that vets are paid, this base, this salary plus production, is in practice actually really hard to implement correctly.
Yeah, and it comes up a lot in practices because if you think about, okay, everybody at a vet clinic is super busy. And who in the vet clinic is in charge of putting in the charges? So it's often a technician or a veterinary assistant who is in charge of putting in the charges. Sometimes it's the doctor who's in charge of either putting in all the charges or at least checking the charges before the client checks out. So there's a lot of variation from one practice to another as far as how that is handled. But one thing is, okay, does management or the practice owner, do they make it a priority to train the folks who are actually putting the charges in that, hey, this is a real priority because it is going to affect the bottom line for the veterinarian? And then if you think about it, if a tech or a vet assistant, I mean, of course, they want to do a really good job, but also they've got a lot on their plates. And patient care is probably going to be more important to them than whether they put the charges in under the right doctor, for example. So they're not necessarily incentivized not to make mistakes, depending on the practice and depending on the practice culture and depending on whether that practice is doing a good job of training them how to put those charges in. And you're right. I mean, I didn't do this. I knew vets and I've worked with vets who checked every single charge after the fact. But it's like, okay, I was already working overtime just trying to get my medical records done. This was like, pre having a lot of the AI software that makes record keeping a lot easier than it used to be for a lot of practices. But, if you're already working overtime, either seeing patients or doing medical records, you don't have time to check charges too. On top of it is just, at some point, it is just not worth it. And you need to, either go home or close the computer and be done with your day. To put another layer, because I worked mainly emergency on top of that, is you've got hospitalization charges and you've got the day shift versus the night shift. And you've got one doctor in charge during the day and another doctor in charge at night. And then are those charges being calculated correctly per day for that patient? So there's a lot of room for error there. And yeah, it's hard.
I'm just imagining the way to actually calculate this correctly is a spreadsheet of thousands upon thousands of different entries for different costs, and whose job is it to go through that to make sure it's 100% correct?
Nobody's. It's nobody's job. That's the problem. That's part of the problem, and that's one thing that when somebody mentions either, going from a salary to a salary plus production, there are reasons that, and we'll get into that here pretty soon, there are reasons that it could be really good to make that shift, but the training and the tracking of the charges is going to be really important in making that shift and also just making sure that it's being done fairly, especially across hospitalization charges for practices where that is relevant.
To move on, but on a similar note that I wanted to talk about is, let's assume they figured it out, that you are being tracked correctly and it's all what I'd call kosher chicken. What you're being paid is correct according to the terms of your employment contract. I don't know if I'd call it a error or shortcoming or just something to maximize, but I did say at the beginning, hopefully you can take something away from this conversation that can help you make more money. For those who the practice is doing a good job of tracking their production correctly, I think a lot of vets would benefit from treating their medicine or treating their job as if they are a 100% commission business person. And what I mean by that is, for better or worse, again, your pay is a direct result in how many people you see. So a lot of people, I guess, don't think about it that way. They only think about, as you should, medicine's the top priority. But I would say, hey, even if your salary plus production, if you are always making production, that's the same thing as being 100% commission, because by definition, to make production, you made enough revenue where you are getting paid more than your base. And that didn't happen unless you made production. So if you are always making production, you are making the same as if your base didn't exist. You are a 100% commission salesperson, whether you like it or not.
David, that's controversial.
It's controversial, but like mathematically, if you are always making production, If they took your base away, your pay would be the same.
Mm-hmm.
Okay, what about the flip side of that? If you are in salary plus production and you never make production, I've never seen a vet that like never made production for years on end without something changing, because what would happen? Eventually, they would just lower your salary if you never make production forever. Now, some practices might do it sooner rather than later, but you get the idea. Just like eventually something would change because you're costing the practice money. And so, if I never make production, and that means eventually my base would go down because I'm not producing enough, that's almost kind of like your 100% commission, because your base didn't matter anymore. They changed it because they had to. And so, for better or worse, whether you like it or not, I would think about your pay as if you were 100% commission. What does that mean, though? Well, I was coaching one of my clients who never thought about it this way. Actually gave her a lot of solace. Like, she felt good about thinking about it that way, because she and like a lot of vets, they almost don't count their production. It doesn't exist. So that when I do get it, it feels really good. But we looked at the past like 24 months of her pay, and this is very common. I see people's production is relatively the same month to month, quarter to quarter. There are fluctuations, but we looked and it's like within $1,000, we could predict what her pay was. By thinking about it more like a business, you can say, well, how can I be more efficient to see more patients in the best way possible so that I maximize my income? And that would generally help versus never thinking about it at all. Meredith, you want to fight me on that? I don't know.
Well, I do want to go back to you saying, it was within 1,000. Like, I mean, there's a lot of variability across veterinarians for production, because I have met vets who get huge production checks during the summer months. And during the winter months, not so much. And they're lucky if they get one at all, or it's much smaller. So there can be quite a bit of variation, seasonal variation, depending on the area where a veterinarian lives. There can be quite a bit of seasonal variation because dogs get in trouble during the summer and kids are out of school. And sometimes that makes it so that it's more convenient for somebody to come in for their wellness exam, etc. So there is some seasonality to veterinary medicine depending on, there does seem to be a regional variation to an extent with that. Other thing that I'm going to talk about that might also be an unpopular opinion, David, is being on salary only still doesn't mean that you're not on commission. And
tell me.
The reason I say that is because you're still, and it's just like what you were talking about, where like eventually that base is going to be lowered if you're not producing enough. It's similar for salary, where like if you're not producing enough, they're going to lower your salary. They're not just going to keep it where it is if you're not producing. Salary still doesn't mean that you're not on commission for that reason. The other thing is, let's say you are on salary and you are just busting your butt, right? You are busting your hump and you're working really hard. When do you get paid for that extra work? Because that's a lot of the draw to those production positions, or the reason that a lot of practices use production is they say, okay, well, if you're working extra hard, you're seeing extra patients, you're working extra hours, etc., we want vets to get paid more for that extra time and effort that they're putting in. If you're on salary, how do you get paid for that? Well, it doesn't mean that you don't get paid for that at all, but you're going to get paid for it probably retroactively. Let's say your contract is up or it's time to negotiate your salary again. They're going to look back at your production over the previous year, and they're going to decide whether you can get a raise. And so what happens is salary only can sometimes mean that you are just getting production, but retroactively. So it's like you're getting a raise for the work that you did the previous year. It'd be nice to get the raise for the work that you did that year, in my opinion, and not like, the year later.
Yeah. Interesting. So, yeah, you're taking it even a step further than I did, where for the salary folks, the pure salary, it's still commission, whether you like it or not, because you said, hey, if you aren't making enough to justify your salary, they will lower it.
Mm-hmm.
And on the flip side, if you are making enough to justify a raise, well, that might not happen for a year after that big surgery you did a year ago. You're still making production, but it's that huge time lag. And I'll even tell me what you think about this. If you're on pure salary, a practice might be quicker to lower your salary if you're not making enough to justify it. Versus what if you are working a ton, doing a great job that would warrant an increase? If you don't ask for the increase, are you guaranteed to get it?
You are not.
Ooh.
Right.
That's worse than the retroactive pay. That's you just didn't get it. The production that you otherwise would have gotten. So it's tough.
And I'll take it another step.
Oh gosh. You're destroying dreams out here.
We know that veterinarians are hopping jobs more often than they used to many years ago. So if you're salary only and the scenarios like we just talked about happen, if you leave your job right now, you won't get that extra money from when you worked really hard the previous year. Ouch.
Dang. So maybe pure salary isn't the way. I don't know. I don't know what the answer is.
Because there are different ways to think about it, and there are some studies out there, and we've talked about some of those on the podcast previously. There are arguments for having different pay structures besides production. One that I want to mention before we get to those other structures, I've got to talk about some of my emergency folks out there. Some of them get paid based on the shift instead. So it's like a salary, maybe you've got a guaranteed salary, but that salary is still contingent on you working a certain number of shifts in order to get that base salary. For example, they may say you've got to work 12 shifts a month for emergency, or maybe it's 14 shifts a month. And so in a way, if you have shift-based pay, it's like you really don't have a true base, because if you don't work the shifts, you don't get the money, which is, fine as long as you don't need to go on leave or anything. And then the other thing is, like we talk about production pay causing vets to have irregular income. Well, if you have shift-based pay, it's even more irregular, because one month maybe I worked 13 shifts and another month I worked 10 shifts. My income could be irregular based on the shifts that I worked plus the production, and it's even harder to budget. So but let's get into other pay structures besides production, because a lot of folks don't, and this is veterinarians out there who have written articles on the subject and done studies, etc. Some people are not huge fans of production-based pay for various reasons. And so there is a thought that, maybe production-based pay has the potential to contribute to either negative culture in the practice, or just to have a negative effect on a veterinarian's wellness. Because, maybe they're in that kind of negative accrual situation and they just feel like they're in the hole and they're not going to get another production check, for example. And so another way that has been proposed is merit-based pay. There's an article out there that is, it's a few years old now. It's a 2018 article that Dr. Joy Furman and Dr. Wendy Hauser wrote called A Prescription for Change. And so we can put that article in the show notes. And so they talk about merit-based pay. Some examples of merit-based pay would be, for example, if you are doing management tasks for the practice. So an example of this that I've seen out in the corporate world would be if you're a medical director and you get a stipend, in addition to the caseload that you would normally see. So a stipend for doing management duties. If you are doing things that add to the practice over time. So for example, if you are mentoring a new grad, because that's one thing, if you think about just straight up production based pay, you're not actually being incentivized to mentor a new grad or recent grad. And the time that you take to do that could actually take away from you producing for the practice. And that's really not a great thing, It's not overall, a good thing necessarily for the profession if you feel like, oh, well, if I'm mentoring this person, then I'm going to make less money.
It could be a lose-lose for the practice too, because if I'm a practice owner, I want my seasoned vets to help train the newbies.
Exactly.
Because that'll make the practice more money too. So I don't want them disincentivized to not want to do that because they would lose out on more production pay.
Right. And it's not good for the new grads. Gosh darn it. They need to learn and they need to have someone who is happy to teach them. Merit-based pay would be, for example, like getting a stipend for mentoring a new grad over a 3 or 6 month period of time. Or finishing a certification, like a rehab certification, for example, or if you take an ultrasound course or an advanced surgery course and you do a certain number of advanced surgeries afterward, then maybe you get a raise or you get a stipend for actually, getting out there and doing the thing and producing extra income for the practice. So those are some examples of merit-based pay. Leadership positions would be another example if you were getting specifically paid for those.
You got to do the thing, though. You can't just get a bunch of certifications and then producing the same amount, and then not doing the thing.
Yeah, you have to do the thing. Don't just take the course and not do the thing. That doesn't really add to the practice. But yeah.
Gosh, any final thoughts? I feel like we could just go on forever. And I don't know if we probably can't solve all the problems that we talked about in the span of, how long this podcast is going to be, 30 minutes. I don't know. But hopefully it gave you some things to think about. Hopefully it was maybe cathartic. Clients have complained to me directly about some of the things that I brought earlier in the conversation. So hopefully this was at least a little cathartic for you. Gave you some things to think about to make you more efficient or think about your comp differently to make more money, because that's really what we hope for you guys at the end of the day. And I don't think this topic is talked about enough.
Yeah.
The more people talk about it, the better comp will probably be in the long run, I hope.
Right. Yeah. Maybe this will give you some ideas for ways that you might propose to your practice management or practice owner for ways that you could get compensated for doing work in the practice, and hopefully just help you keep in mind some of the pitfalls that are out there.
I guess with that, we'll wrap this up. And so if you want to complain about your comp structure directly to us, we would love to hear it. Or if you want to tell us all the things that we missed in this episode, we would love to talk to you. Or if you have questions, or if you want to work with us, what if you could get fiduciary veterinary specific financial planning that's student loan aware? That could change your life. If you want to work with us, go to slpwealth.com/vet. Or if you have any questions, if you just want to talk to us, that's fair game too. Go to slpwealth.com/vet. That's slpwealth.com/vet for a free 15-minute intro call to see if we could be a good fit for you, or if you want to just pick our brain about comp. I'd love to talk to you anyway.
Thanks, everybody. And until next time, take care and continue your path to financial success.
This podcast is for informational and educational purposes only and should not be considered individualized financial advice.
If a specific investment is mentioned, it should not be considered a recommendation or endorsement to buy or sell the investment.
All investments involve risk.
Past performance does not guarantee future results.
You are encouraged to seek the advice of a financial professional before implementing any investment strategies discussed.
Yay, compliance.